Thank you very much, Presiding Officer, and I need no further invitation to speak at length. I believe that hospital-acquired infections are indeed the greatest challenge that face our health service today. We in this chamber have a duty to meet that challenge head-on so that the people we represent in all parts of Scotland can feel confident that when they enter their local hospital for treatment, they will be treated in safe and clean conditions. Our natural expectation is that we go into hospital to get better, not to be made more ill. I recognise that some progress has been made and the overall number of cases is reducing, but this is not reflected equally across Scotland. Persistent problems remain in some hospitals in different parts of the country. I do want to pay tribute to the staff for all of their efforts in trying to drive down infection rates. They are often working in difficult conditions, without the right resources to do their job, in many cases understaffed and ill-equipped. They are faced with a plethora of initiatives, different sets of guidance and no clarity about priorities. They clearly need our support and our help in the fight against C. diff, but they also need clear leadership. I also recognise that C. diff will always be with us. Experts tell me that it cannot be eradicated, but more importantly, they also tell me that deaths are preventable. And that is the nub of the matter, the real challenge for us all, how we minimise and ultimately stop people dying of C. diff. I want at this point to pay tribute to the C. diff Justice Group. From a small number of families affected by the outbreak at the Vale of Leven Hospital, coming together to share their grief, the group have grown in numbers and grown in determination. They have pursued the government relentlessly, demanding action and fighting hard to secure a public inquiry. You know, their purpose is very simple and very clear. No other family should have to go through what they have been through. And yet, since the outbreak at the Vale of Leven Hospital, we have witnessed outbreaks at Balfour Hospital in Kirkwall, Caithness General in Wick, Dr Gray's Hospital in Elgin, Woodend, Aberdeen Royal Infirmary, with the highest number of cases, something like 438 people infected with C. diff in the space of a year, and now at Ninewells in Dundee. Our thoughts are, of course, with all those families that have suffered, not at this stage. Our thoughts are, of course, with all those families who have suffered the loss of a loved one to C. diff. But I suspect that, like the families from the Vale of Leven, they would much rather have action than warm words. Let me turn to the events at Ninewells Hospital. We learned last week...
Brian Adam.
Made reference to over 400 cases at Aberdeen Royal Infirmary. I hope she's not trying to imply that these were all acquired within the hospital, because many of the cases actually occur in the community. The Mail will have identified 400 people who had the infection. That doesn't mean to say it was acquired in the hospital.
Jackie Baillie.
Could I say I agree that we have a problem in the community as well, but it is regrettable that one of the actions that we have previously talked about in this chamber, which is doing something about that and monitoring what goes on in care homes, has yet to properly be done. So I would hope that Brian Adam would support the extension of that rigorous inspection to care homes too. Let me turn to the events at Ninewells Hospital, because we learned last week that 5 of the 8 patients who contracted C. diff in Ward 31 sadly died. 3 patients were confirmed as having C. diff on the 14th, the 17th and the 18th of October. An outbreak declared on the 19th and the Cabinet Secretary was told on the 21st. It emerged that Health Protection Scotland visited the hospital on the 29th of October, 15 days after the first case was identified. And then the new Healthcare Environment Inspectorate went in on the 11th of November, a full 28 days later. This is frankly extraordinary. I don't think the scale of the problem has been quite grasped. The Cabinet Secretary told us last week that we should not make comparisons with the Vale of Leven. There, the outbreak affected 55 people, 18 people died, and it occurred over a 6-month period across 6 wards. The mortality rate at the time, the worst in the UK, was 33%. Yet here at Ninewells, the mortality rate is 62%. The affection appears to be concentrated in one ward, but it is 15 days before Health Protection Scotland show up and 28 days before the new inspectorate pitch up. Did it not occur to anyone that perhaps the staff at Ninewells could have done with some support and advice, some guidance on what needed to be done? I find it quite shocking to discover that our procedures for dealing with food poisoning outbreaks are more robust than those tackling C. diff, which we know is more deadly and has claimed more lives. Let me quote the words of Professor Hugh Pennington. Current policy leaves the failing hospital to investigate itself at the most important time in an outbreak, its early stages, when prompt action is most likely to nip it in the bud. In regulatory terms, the contrast with the action that is taken in response to food poisoning outbreaks is stark. Such outbreaks are caused by microbes that have mortality rates much less than C. difficile. But as soon as they're declared, they're investigated by independent outbreak control teams with speedy action as their hallmark. The inspectors dig deep at once in a second. They have powers to close premises which they use. They prosecute. On the other hand, for the NHS in Scotland just now, it is like a supermarket, with a food poisoning outbreak being left to investigate itself, handle its own media inquiries, only being inspected weeks later.
Nicola Sturgeon.
Doesn't want to give a misleading impression, but will she accept that she is giving the impression that when the outbreak was declared at Nine Wells, nothing happened for several days? So will she accept and put into her speech the fact that as soon as the outbreak was declared, the ward was closed, the outbreak control team was established and the outbreak was being actively managed by the staff at Nine Wells Hospital?
Jackie Baillie.
The Cabinet Secretary knows very well that I'm not suggesting that at all. What I am suggesting is that the Scottish Government must act. We do need earlier intervention. The inspection team must be in right away, not 28 days later. They must have the powers to close wards, tackle the problems and ensure the safety of patients.